Call the member for Murray.
I thank you, Mr Deputy Speaker. This is the 7th Closing the Gap report since the targets were set up by COAG in 2008. There has been some improvements in outcomes in education and health, but on the whole, Indigenous Australians continue to experience vastly increased rates of incarceration, lower life expectancy, higher rates of many life-threatening illnesses and poverty when compared to non-Indigenous Australians. But I think we must look beyond just some of those very sad statistics and focus on particular communities. For example, Aunty Melva Johnson, who is an elder of the Yorta Yorta community living in Echuca. She was forced to give birth on a veranda at Echuca Hospital when she was a younger woman. She then, a little later, worked in the hospital as an unskilled supporter, but now she's on the Echuca Hospital board. She actually takes part in managing that very large public hospital. In her one lifetime, she's gone from being a pariah, forced to give birth on a veranda, through to now being part of the hospital management board. I think that's an extraordinary situation and one we must celebrate. Now, when I was elected, I have to say that the protocol of acknowledging country and welcome to country, they were practically unknown. In fact, if you'd acknowledged country, people would have wondered what on earth you were talking about. But today we have that protocol of acknowledging country or receiving a warm welcome to country, particularly in my electorate, virtually every day. And the flags of the Indigenous and Torres Strait Islanders fly at most schools, particularly the Aboriginal flag, alongside the Australian flag. And of course, if we're in Queensland, you'd see many more of the Torres Strait Islander flags proudly flying. But sadly, our Australian history, our curriculum in our states and wherever there is still Australian history taught to an extent, it still does not teach about the pre-colonial Australian cultures, nor of the culture contact period, the period when the people who were invading Australia largely from Britain didn't understand the way the Australian continent was owned by numerous numbers of tribes, each with very distinct and well-known boundaries, who were prepared to protect those boundaries with their own lives, not just from the new colonial British, but also from one another if there was an incursion. So we have a situation in Australia too often where there's a lack of understanding of why we have right now such extraordinary rates of poverty, violence in communities, why there is very high-risk alcohol and other drug consumptions which lead to violence, neglect of family, often brain damage, and certainly some of the highest rates of incarceration in the world. Too many young Indigenous Australians are born with irreparable brain damage, particularly their cognitive capacities, which are the consequences of their mothers drinking alcohol when pregnant. Now, we all know the statistics where per person Indigenous Australians are less likely to be a drinker compared to the alcohol consumption in non-Indigenous Australian. But when Indigenous people do drink alcohol, they tend to drink at much higher levels of risk. So a recently published report on the incidence of fetal alcohol syndrome and the fetal alcohol spectrum disorder in an Indigenous community in Western Australia has found some of the world's highest rates of irreparable brain damage and other associated disability in the population of children under 8 years of age. And ironically, that particular community has imposed some of the most successful alcohol reduction strategies in their community in Australia. But now they have to live with the legacy of the alcohol impacts of the earlier high-risk drinking rates that were prevalent in their community for generations. We've just recently had a tragic car accident where one of these young, damaged people, only some 13 years of age, has been involved in an accident and there's been deaths. And this is a tragic outcome for that community who's seen so many deaths associated with high-risk drinking and the violence that often ensues. Now, I chair the House of Representatives Standing Committee on Aboriginal and Torres Strait Islander Affairs, and our current inquiry aims to identify the reasons why Indigenous communities are drinking alcohol at such high risk levels. We want to identify successful strategies that have reduced alcohol consumption or have helped those with drinking problems to be rehabilitated. We've seen, unfortunately, very few examples of these successful strategies. Too often, the strategies that we do come across, identify, are extremely short-term in their funding duration, or they have lost a champion who was making sure that they were well established and functioning in a particular community. The impacts of the high-risk drinking include, of course, extreme levels of violence, some of the highest levels of violence you'll find in any communities in the world, child neglect, poverty, and of course, as I've already said, incarceration rates that rob children of their parents, particularly their fathers, as they grow. But unfortunately, there are also extremely high rates of Indigenous women related to their high-risk alcohol consumption. Now, our government's priorities for making real improvements in the lives of Indigenous Australians include getting children to school, keeping them there for a good education, getting adults into work, and making Indigenous communities safe so people can live, work and raise their families. And as I've been inferring, one of the key ways to make sure these communities are safe, that the adults are able to have meaningful work, and that, in fact, the parents supervise their children's school attendance. All of that very often is affected by whether or not the families are addicted to alcohol and other illicit substances. And one of the saddest things about the inquiry that we're undertaking now in 2015 is that almost the identical terms of reference were given to a committee in the 1970s chaired by Mr Philip Ruddock. And those terms of reference came up with, I'm sure, what will be similar outcomes and conclusions as our report will find. And that is the tragedy of Australian Indigenous life. The fact that we have been trying, government after government, state, territory and federal government, to find ways forward. I don't agree with the previous speaker who said it's just about resources. It's not just about more financial resources. It's about strategies that are put forward by Indigenous communities themselves. It's about champions like June Oscar and Mummergee and Fitzroy Crossing, who are stunningly courageous women who have taken issues in their community and run with them and are really working towards a better life for their children. But unfortunately, in our particular inquiry, we are finding that there is still a great deal of despair, people throwing up their hands saying we've tried everything, we're not sure how to get children to stay in school, we've tried removing welfare access, we've tried having the children go to other places to school, but we still haven't as yet managed to find an outcome which ensures most children, most Indigenous children, go to school and stay in school and end up having choices in their life other than going back to a very remote and small community where their destiny is probably likely to be like that of their fathers and mothers. That is a life of abuse, poverty, poor health and too often incarceration. I just want to read a section out of a book, one which I produced many years ago in the 1970s, which looks at the evolution of Australian government policy in relation to Indigenous affairs. This is a speech made by Paul Hasluck in the House of Representatives on the 8th of June 1950. And it says, according to the census that was taken in 1944, there were then in Australia 71,895 persons who were classified as Aborigines. He goes on to talk about how many were half-caste, but he says that 1/3 were classified as nomadic and slightly less than 1/3 were classified as being in employment. So the employment issue was really being addressed. This is prior to the time of a lot of welfare being available. And he says the problem today is not a problem of protection. In the old days, when they were a primitive people living under primitive bush conditions, the problem chiefly was to set up a barrier between them and the invading white community. Those days have gone, and the nation must move to a new era in which the social advancement rather than the crude protection of the natives should be the objective of all that is done in this sphere. He goes on to say we must either work for the social advantage of Aborigines or be content to witness their continued social degradation. And he says that the future lies in association with us. The future lies in association with us, and they must either associate with us on standards that will give them full opportunity to live worthily and happily, or be reduced to the social status of pariahs and outcasts living without a firm place in the community. In other words, we either permit this social evil to continue or we remedy it. If we take away some of the racist language we're out of here, which refers to these people as primitives and so on, I think the sentiment is the same now as it was 75 years ago. and that is that we have people in our Australian community who are underemployed or unemployed, who are not enjoying the advantages of being full members, participating members of our Australian community. And I think he's saying they can either be pariahs and outcasts, or they can live with the community and enjoy all that is good.
I thank the member for Murray.